So I'm Jo Brown and I work with Southern Grampians and Glenelg Primary Care Partnership, and we work with 20 partner agencies across the Southern Grampians and Glenelg Shire to improve health and wellbeing. And one of our strategic priorities is to reduce the impacts of climate change. And our journey started in about 2008 when our agencies started to recognise that there were impacts of climate change on their community and that we need to be responding and doing something about it. So we were looking at household energy efficiency, access to food, water security or access to water, transport and social connection were really our top 5 things that we thought were the most important or had the most climate change impacts, and that our role fitted really nicely in as a PCP. And we worked with our community and our partners to understand what was their priority, and household energy efficiency was the priority really for people. It kept coming up again and again as the main, what people were most vulnerable to, rising energy prices. And it's sort of a bit funny coming from a health agency. You know, sometimes the community think, well, what have you got to do with the cost of rising cost of energy? So we probably had to build our case a little bit that these things have health impacts. We were seeing things like, really hot days, people who had maybe air conditioning not using it because of the cost, or people using air conditioning but their house had so many gaps and drafts that, it was costing them a fortune basically to cool the outside air. So we worked with our partner agencies and extended our understanding by running some practical projects with communities for 2 reasons. One, to help reduce vulnerability of low-income families, particularly to rising energy costs, but also to increase the capacity of our partner agencies so that they understood that they would have a role to play in climate change impacts. And so I think that building those relationships over time has been what has most certainly kept the momentum going and kept our enthusiasm going. If I could give somebody advice about working with communities, is really understand what the community want and what is relevant for them. Where is the best part for this community that we can work with, rather than taking an approach and saying, well, this is what's going to happen in your community, which it's just standard community development practice, really, understanding what a community wants and needs and going to the community and understanding them.